What would be a funny thing to say to a surgeon before anesthesia kicks in 5 seconds later? As an anesthesiologist, let me clear some things up here. Rarely is the surgeon even in the or during induction going to sleep time. Usually just the anesthesiologist or nurse and person that helps with instruments for the surgery are present. I've heard and seen every crazy thing imaginable, including people's deepest fears and secrets. Mostly this is caused by a premedication such as first removing inhibitions. Every now and again I'll hear something that will even make the entire room chuckle. 99.99% of the time whatever you say has already been said and isn't nearly as funny or original as you think. I often hear from patients in pre-op that their biggest concern is saying something they will regret, and I always reassure them the majority of people talk a lot less, and the ones that do talk usually hold relatively normal conversations for the brief period of time of getting a premedication to going under full general anesthesia. Point now is we are talking a case involving moderate or deep sedation and not general anesthesia. It's completely different point. If I were to have surgery and the anesthesiologist not know me or my profession, I'm sure I'd do my best to prank him by saying something completely obscure about anesthesia and just give him a wink. Point edit. Since my inbox is getting filled with medical questions, please talk to your anesthesiologist the day of surgery about your complete medical history. It all matters. Let him/her determine what is important to your care. Bit of a long one here. So about 2 weeks before I had a back surgery, L4-L5 laminectomy, I asked all of my wittier friends for some funny stuff to say before going into the OR. Most were along the lines of, well, I guess I can't back out now, or something of that nature. One friend however told me about a post he had seen where before an operation someone said, "Doc, am I going to be able to play piano after this procedure?" And the doctor responds, "Well, of course," and to that the patient replies, "But, because I couldn't before." Dumb joke, I know. But for some reason I decided that was going to be my funny comment before going under from the anesthesia. So come the day of surgery, I'm getting prepped and transferred to the OR, and then bam, I'm waking up in recovery. I had missed it. Or so I thought. I very slowly started to mumble the question about my ability to play the piano, because I had come this far, and I was not going to leave without saying it. Without hesitation the doctor at the foot of my bed goes, "No, you can't play the piano. You never learned how." I was stunned. Had he heard the joke before? Turns out I had asked the question after they administered the harder drugs and I didn't remember. He had a good laugh. The nurse to my side had a laugh. I laughed, probably because of the morphine, and all was right in the world. TLDR, I thought I forgot to say my funny thing, but turns out I had, and the doctor finished the joke for me. Alright, I know I'm super late to the party, but hopefully someone sees this and laughs. I had appendicitis when I was 19. Worst pain I've ever felt in my life. The nurse comes in, and I'm not in a gown yet, don't know why. Anyway, she says, "We are going to give you some Dilaudid for your pain." And I'm thinking, fuck yeah, this sheet hurts. She proceeds to give me the drug. I feel warm in my arm at first, and then warm all over. I'm in La La Land. The nurse tells my dad jokingly that I'm a lightweight. A short time afterwards, I think, the nurse walks in and says that they need to prep me for surgery and that I need to get undressed. She helps me get out of my clothes and into a gown, then looks at me and says, "Your underwear too, they need to come off." Right at that time this little lady walks in. She's in her 20s, and I notice she has a bonnet on and a long skirt. She's a Mennonite that works in the hospital doing registration. I proceed to take my boxers, which were covered in sweat from the fever I had, whip them around my head like a faking cowboy and sling them at that poor lady. Needless to say, my aim was true, and they nailed her right in the face and slid down her chest very slowly. I remember the horrified look she gave me, and then I passed out. The next thing I remember was being on the operating table and the doctor telling me to count back from 100. All I could get out was POW right in the kisser. As I slowly faded away, I still wonder what that doc thought when I said that. I sort of reverted back to my man instincts when I was put under, when they had to crush my wisdom teeth to get them out. It was bad. The last thing I remember was laughing at a stupid joke, and then my whole body got cold, and it was suddenly like I was very faking drunk. My body went limp, my arm shot out to grab onto anything. The anything that I ended up grabbing was a nurse's boob. She held my wrist and said it's okay, and gently pulled me off of her. I was out. Shortly after the surgery I was wheeled into the recovery room. All the nurses were red-faced and giggling, and I felt the need to announce just how hard I was hallucinating. I'm tripping faking balls, mom. And I remember what I saw. Good lord, I was on some powerful shit. I was yelling that all the way out to the car. The patients in the waiting room were apparently horrified/amused. On the way home I got into a story about something me and a friend did, and my mom asked me what else did you and him used to do, and I looked her dead in the eye and said hookahs and cocaine, and slammed my head into the window and passed out. I woke up pulling my stitches out. I came to mid-pull. So yeah, anesthesiology is some wicked shit. TLDR, grabbed nurses' tigs, was told it was okay. I've had a number of surgeries. Here's my history of fun twilight moments. Surgery 1. 2 or 3 years old. I guess it was in 1988, so I was 2. I just remember being in the room with the light there. The ceiling looked black from where I was, and I remember thinking how vastly different this room looked from the rest of the hospital. Surgery 2. I was 9. The anesthesiologist was super friendly. He was asking me about my dog last. I remember surgery 3. I was 22. It was time to try to fuck with the surgeon/anesthesiologist. Can you film this surgery so I have a copy? No. Oh okay. Well can you? Out. I was going to ask him for an audio recording. I clearly had begun to slip. Surgery 4. Circumcision at 24. I was in the OR and the anesthesiologist was there. He threw the gas mask on me, never had that before, and began to inject me. I was getting really loopy and the gas mask smelled like diesel fuel burning. I remember telling him I'm not counting back from 10. I'm going to fight this. You can't. Surgery 5. 2 weeks ago. The anesthesiologist began pushing some drug in my fourth and had a handful of other shit including propofol. I made a Michael Jackson joke and asked him if I was about to leave for a while. He told me no. I began scheming up a plan as I was talking to him. The motherfucker or some nurse was cleverly pushing other drugs into me at the same time, and I had no idea. Next thing I remember, I was back in the recovery room. I think the next time, since the surgeon isn't usually in the room while the anesthesiologist is working his magic, I'm going to say something like, if I die on the table, tell Drive that he is a magnificent lover. If it's a woman, I'll say tell Drive that she is the greatest underground MMA fighter I've ever seen. Either way, it's much more fun to fuck with the nurses/anesthesiologist in the recovery room. Once you realize that you're out of surgery, despite the hangover from the drugs and the morphine coursing through you, you do reach a point of lucidity, if not momentarily. The anesthesiologist visits me in the recovery room because I have a heart condition and they always like to give me a debrief on how my Passamaquoddy did while I was under 2 weeks ago. I woke up, asked if I had surgery yet. I can never tell. Seriously, it's like you blink and you're in a whole other room, and when they say yes I ask them if the set change went well and if everything looks realistic. Not exactly the question, but I once went to a procedure, spinalangiogram. This was a few months before I got my spine circumcised, with one of my friends as my chaperone. My friend makes Bane look small. He's 6 feet 8 inches, ex-military, works out with active duty special forces. He's an intimidating physical presence. When one of the neurologists popped in to check on me and explain the procedure, he asked if my friend was going to stay and take me home. I said, yes. And he's also here to make sure there aren't any complications. I said it as a joke, but I tend to be pretty bad about getting tone of voice right, so it came across as a pretty sincere sounding threat. The poor neurologist turned pale and excused himself. I don't think he thought it was funny point, and despite making an unintended threat of physical harm, they botched the anesthesia and I came out of it in the middle of the procedure. Confused and agitated, I tried to move around, not knowing what was going on, or that there was a catheter threaded into my femoral artery, and I risked tearing it. The docs panicked and cranked up the juice, and I was out moments later. It was a good long time before I came out of it in recovery. A while back I was having a carotid endarterectomy at the VA hospital. When I was wheeled into the OR, I noticed that they had music playing. It was that damned song. So, you had a bad day? I just looked around at the team and said, really? When they were prepping me, one of the surgeons asked if it was okay if a third-year female resident scrubbed in. I looked at her and asked if she was sterile. As she was being wrapped in her gown she said, of course. I said, that's okay. You can always adopt. The surgeon laughed and said, knock him out. When I woke up 5 hours later, hospital staff were coming into the room to check on me, and they kept laughing. I asked them what was so funny. One doctor said, oh, you don't remember, do you? I said, no. He said, you were doing a great stand-up routine with voices and everything. I said, damn it, my best work and nobody recorded it. Allah. Open range. Postscript. The most painful part of the pre-op was the arterial. It was a teaching hospital and a new nurse was trying to get a line in my right arm artery. That was painful enough, but she continued to use lidocaine on the arm, which makes the arteries shrink away. She finally got a supervisor to come in, and I told her, if you do this again without Versed, I'm going to knock you the fuck out. She said, oh, you like Versed, no problem. It's like the sleep before the sleep, plus, normally it's an amnesiac. I'm a big fan of Versed. Had it many times during cardiac caths. The fact that I remember that conversation shows that in that case, it didn't work. I had my wisdom teeth cut out in 1999 or 2000. I have a severe fear of needles. So much so that I've been known to pass out after getting a shot or a knife. When setting up the appointment, the doctor offered me gas, nitrous, prior to sticking my hand with the needle. That would put me under, which I happily agreed to. On the day of the surgery, they told me to wear an old shirt in case I bled on it, etc. So, I wore an old Metallica concert shirt. When I got to the dentist office, the anesthesiologist was a older, but still pretty attractive blonde woman. I'm usually very nervous anyway about getting needles, obviously. But, now I'm double nervous about looking like a total chicken shit in front of this beautiful woman. She leads me back to the chair and reads that she's to give me gas prior to the needle. She must have picked up on my nervousness because she started making small talk. She put the gas mask on me and I started to feel pretty relaxed. She saw the Metallica shirt and asked, oh, do you like Metallica? Trying to play it cool, I said, oh, you know. Back when I was in high school, I went to a show. They were pretty good. I was a huge fanatic. By this point, she had stick me with the needle. She said, in the 80s, I actually went backstage and partied with those guys one time. They came through, being a bit too comfortably gassed. By this point, I slowly looked her body up and down and replied, yeah, I bet you did. And slyly smiled at her. That was my last memory before nodding off. Funny story. I was playing a competitive Sunday league match of 5-a-side soccer in 2012. Our goalie couldn't show up, so I had to stand in for the whole game. To everyone's surprise, I had kept the other team at bay for a majority of the game, letting in only one goal. As they got more and more frustrated, their shots got harder and harder until one shot hit my finger and it hurt so much I had to sit out the rest of the game. We won, but I found out the next day that the shot was so hard it fractured my finger and needed surgery. So here's when the story gets interesting. The surgery was scheduled 2 weeks later, and in that time, word got around that my finger broke from a hard shot and the guy who did it felt so bad that he thought it would be fair to at least buy me a drink or dinner. So I took him up on that offer, and over our meal, the question of who is your surgeon came up. I gave him the name and hospital, and as it turns out, the surgeon is his dad. It was weird hearing that, but I didn't think too much about it. Anyway, a few days later I was on the operating table making small talk with the surgeon and the anesthesiologist when I feel the anesthesia kick in. One of the last things I said was, "Hey document. Did I ever tell you who broke my finger? Your son." Awkwardness ensues when I wake up. TLDR. Broke my finger playing soccer. The guy who broke my finger is the surgeon's son. Let me preface this by saying that I tend to nervously talk and anxiously crack inappropriate jokes in times of stress. When I was 19 I ended up needing to get sinus surgery. It was my first and only time being put under, and I was a bundle of nerves. My anesthesiologist came in and was telling me about the procedure and settled on telling me how the intubation is the worst part for most people, and how after surgery the process of incubating can leave a patient's throat scratched and uncomfortable. He then asked me to open wide and looked into my throat and exclaimed, "Well, what a nice wide throat you have," and I replied with "Thanks, my boyfriend thinks so too." To which my mom replied, "Canadian chick." But the anesthesiologist laughed and said, "Don't worry. I always get the last word." Well, on the table, as he was preparing me and getting the needles placed in my hand, he hit a vein and blood spurted out. I remember saying, "Way to go, doc." My mom was dragged in with me because we are damn close, and I was seriously thinking this was it. I'd be the one to not wake up from sinus surgery, and she said the anesthesiologist looked at her and said, "Guess I'm settling for second to last." Okay, I have a story point. When I was 12 I had to have an appendectomy. I was delirious to say the least from the fever and lack of sleep or ability to keep food down. I had never had surgery before, so as soon as I heard I would be going under a knife, my mind went to full-blown insane panic mode, but I tried to keep my cool for the doctors. Anyway, I get into the surgery room and they start injecting this white liquid into my eye. I assume it was the anesthesia because I passed out a minute after they put it in, but that was after I experienced an extreme burning sensation in all of my veins. It hurt so bad, and I'm way out of it, so I start freaking out, start trying to get out of my bed. The nurses try to hold me down, they fail. I was a big 12-year-old, I was 6 feet by the time I was 13. Then my surgeon tries to hold me down. I was scared to death. I thought I was going to die, so I sucker punched the dude right in the face and then passed out. I only knew it was my surgeon because I woke up to his face just looking at me with a shiner right underneath his right eye. TLDR, I sucker punched my surgeon before my appendectomy because I thought I was going to die. I had a consultation with an oral surgeon for wisdom teeth extractions, and while he was nice and all, he tried a little too hard to try and be hip and relate to me. He was probably late 30s or 40s and quite awkward, albeit friendly. He would try to relate to me on college and my major to playing instruments. When I went in a week or so later for the actual procedure, I was super excited cause I was on Valium and sheet. Everything is so pretty on Valium. I was being put under, and I always wanted to see how long I could fight it. So I went in, got settled into a room, and the nurses were around setting everything up and making sure I was okay. No doctor in sight. The nurse starts injecting me with something, and again, I'm super excited cause I was always like, PFFT anesthesia whatever. I can fight it. Mind over body, beaches. As soon as the nurse is done, I sit around wondering when it'll kick in. The door slams open, and that irritating voice says all cheerily, "Hello. How are we this afternoon?" And I just noped the fuck out, thinking, oh god, he's gonna start talking to me again. Knockout. Hush, good. Knockout right now. Thankfully, I did. Woke up to an empty room confused and with gauze in my mouth. First thing I did ask for was to keep my teeth. I feel like I took a really long time to go under. I distinctly remember telling the anesthesiologist, "Aha, it does taste like bananas," right after the injection was given, because at that moment I seemed to have some epiphany about anesthesia having that effect. Pretty sure I made it up on the spot and had never heard it before. I then told the anesthesiologist that he had a halo and must be an angel. I was probably going cross-eyed and was blurring the ceiling lamp with his head. I started feeling myself getting silly and slipping away, so I told the surgeon that I hoped he had a really great surgery and wished the whole team good luck. Then they put a mask on me, which they said was O2, and I tried yelling out, "You made a mistake, this isn't oxygen," but I probably only slurred out a UMRRGGHR. Before going out, I started crying when I woke up though, because in that last second I really thought I was going to suffocate after they forgot to put the air on. In the recovery room I was excitedly telling them I didn't die, I'm alive. I'm sure they deal with some wacky stuff, but I hope my 17-year-old self amused them at least a little bit. Maybe you guys can keep the banana spirit alive.